reviews of the research literature have shown that when these studies are looking at religious involvement and, for example, depression and anxiety, that the overall correlation is significant across all of the studies. However, the correlations are about 50% stronger when these relationships are looked at in traumatized populations. And so it seems as though that in vulnerable populations, that's where the benefits really kind of come to the surface, so to speak. So religious involvement has been correlated with lower rates of depression, and actually as you follow people over time, and we have done some of those studies, as you track people over months, over years, you find that if they experience a depression, if they have depression initially, that those who are more religious seem to recover more quickly from the depression and get back to more their normal selves when you just observe them over time. Also, there are spiritually integrated, religiously integrated interventions for depression that have been shown to be as effective as secular interventions for depression, but particularly effective in those who are more religious. So if you have, for example, a religious service member, that those individuals would probably respond significantly more vigorous to a religiously or spiritually integrated therapy if they were experiencing depression than they would from a standard secular treatment. So there is evidence for that. And we actually have done that, have provided that evidence that's been published in peer-reviewed psychiatry journals at this time. But that's pretty much the pattern that you see with anxiety as well. You see that again, religious people experience less anxiety. They're less fearful because part of it has to do with the practices, I think. Being able to pray or to meditate and having a powerful belief system that helps to give a person a sense of peace, gives them a sense of control, helps to relieve that anxiety.